Welcome to The Explainer. I am so glad you're here. Today, we're tackling a massively popular topic in the world of physical recovery and pain management. We are talking about myofascial release therapy. You've probably heard people absolutely rave about it, or maybe you've even tried it yourself to work out that stubbornly tight knot in your shoulder. But as with literally any interventional therapy, it's absolutely crucial that we separate the marketing hype from the medical reality. So today, we're going to take a close look at the data, the safety precautions, and yes, the potential dangers of this treatment.
So, is myofascial release actually safe? That's the golden question, right? We often hear this therapy described as a total miracle for relieving muscular tension, improving joint mobility, and enhancing recovery. And while it for sure has incredible benefits, we really have to ask ourselves if we truly understand the clinical realities involved. Because the honest truth is, no interventional therapy is completely risk-free. Zero. To make the best, safest decisions for your own body, you need to understand not just how it helps, but what happens when things go sideways.
Okay, let's dive into this. Here's our roadmap. First, the foundation. Second, the expected. Third, the unexpected. Fourth, the red flags. And finally, the blueprint for success.
Section 1. The foundation. What is MFR? Before we even touch on safety, we have to establish exactly what part of the human body this manual therapy targets.
Now, what's really fascinating here is the definition of the fascia itself. See, fascia actually isn't your muscle at all. It's the continuous, interconnected web of tissue that completely surrounds and connects your muscles. Think of it kind of like the casing on a sausage, or maybe a tightly woven spider web that's holding all your internal structures together. It's a huge player when it comes to your movement and your stability. But when you place a lot of repetitive demand on your body, this fascia can become super tight and restricted. And that tightness, that leads directly to pain, stiffness, and a seriously reduced range of motion. So during myofascial release, a trained therapist uses sustained pressure and stretching specifically targeted at this fascial tissue. They aren't just rubbing the muscle. They're deliberately releasing that taut tension to help restore your natural movement patterns.
Section 2. The expected. Normal side effects. Because, let's be real, when you physically manipulate the body's structural web, there's going to be a reaction. If you've never had this done before, you might actually be a little surprised by how you feel afterward. The most common reaction, by far, is temporary soreness. The absolutely crucial point here is context. You really should think of this exactly like post-workout soreness. When you hit the gym and lift weights, you fully expect your muscles to be tender the next day, right? Well, myofascial release works your tissues deeply, and feeling sore is a totally natural, self-limiting response. You can generally expect that soreness to fully resolve within about 24 to 48 hours.
Aside from the soreness, there are a few other highly common reactions you should know about. Because of the direct pressure applied to those tight areas, you might see some minor bruising or feel localized tenderness. You might also feel pretty fatigued or even slightly lightheaded immediately following a session. And that happens simply because the therapy stimulates increased blood flow and deep, deep relaxation. But here's the really fascinating part: an emotional release. When deeply held muscle tension is finally allowed to just let go, some patients experience a sudden release of pent-up emotion. People actually often refer to these combined reactions as myofascial release detox symptoms, since your body is actively adjusting and resetting itself. It's all totally standard.
But what happens when things don't go according to plan? Section 3. The unexpected. Understanding the real dangers.
And this brilliantly illustrates the difference between healing and harm. On one side, we have our normal responses, that temporary soreness and mild bruising we just talked about. But on the other side, we have what is firmly not normal. We're talking severe pain, continuous discomfort, or a terrifying situation where your underlying condition actually gets worse. While it is true that symptoms can occasionally feel slightly more intense right before they improve, severe or prolonged pain is an absolute medical red flag. It is never, ever part of the normal healing process.
So, why do those not normal reactions happen in the first place? Well, almost exclusively, they're the result of improper application. If this therapy is done incorrectly by an untrained individual, the risks literally skyrocket. Applying excessive manipulation to your tissues can actually irritate them further, creating excessive pressure injuries that just aggravate inflammation rather than curing it. On top of that, the human body is a minefield of highly sensitive areas. Working way too aggressively near major blood vessels, delicate nerves, or your vital organs can cause severe, lasting complications. This is exactly why professional screening isn't just a polite suggestion, it's paramount to your safety.
Section 4. The red flags. Who should avoid it entirely?
The hard truth is, not everyone is a candidate for myofascial release. You literally must avoid this therapy or get explicit, rigorous medical clearance first if you have any of these specific conditions. We are talking about open wounds or healing surgical sites, acute infections or fevers, recent fractures or severe osteoporosis. Crucially, if you have blood clotting disorders like deep vein thrombosis, DVT, or aneurysms and vascular conditions, applying deep sustained pressure to your body can be incredibly dangerous. We're talking life-threatening. The same exact rule applies to severe joint instability. A truly qualified professional will always screen you for these exact issues before ever laying a hand on you.
Thankfully, for the vast majority of people, those major risks are entirely avoidable. Section 5. The Blueprint for Success. Maximizing Safety.
All right, here are your proactive, actionable steps for a safe, holistic recovery. Step 1, only ever work with a qualified provider, someone who is specifically trained in anatomy and safe pressure techniques. Step 2, stay intensely hydrated post-session. Guys, this isn't just generic health advice. Hydration specifically helps your internal organs recover from that increased blood flow and actively promotes the fascial tissue healing process. And step 3, stop treatment immediately if your symptoms worsen or if you experience dizziness or severe pain.
This brings us to a critical reminder. Share with your therapist how it is impacting you. You, as the patient, have incredible agency here. The pressure applied during a session should always feel firm, but it should be completely manageable for you. It should never feel sharp, and it should certainly never be unbearable. If it is, speak up immediately. Constant communication ensures the treatment is modified perfectly to your unique threshold and your body's needs.
To truly maximize your success, you really shouldn't look at myofascial release in isolation. Combining it with a comprehensive, multidisciplinary approach drastically lowers the dangers while massively boosting your results. For example, clinics like Core Chiropractic Center and Rehab successfully stack myofascial release with other targeted treatments. Chiropractic care removes fixed spinal tension, physiotherapy rebuilds your functional muscle strength, innovative MLS laser therapy actively reduces underlying inflammation and stimulates tissue repair, and shockwave therapy encourages healing in stubborn chronic ailments. By layering these therapies together, you're addressing the actual root cause of the pain, making the entire recovery process significantly safer and far more effective in the long run.
So what is our ultimate takeaway today? Honestly, it all boils down to a very simple equation. Proper screening plus expert oversight equals safe, long-lasting results. Yes, myofascial release therapy carries risks. It has mild expected side effects and, if done poorly, severe unexpected dangers. But those risks are highly manageable when the therapy is integrated into a personalized plan by a seasoned, knowledgeable provider. Empower yourself with this knowledge, communicate your boundaries clearly, and ensure your treatment aligns perfectly with your broader fitness and health goals. I want to leave you with this final thought. Your body is this incredibly deeply interconnected web, and pain is really just its way of communicating with you. The stiffness, the tension, the lack of mobility, it's all data. So the real question is, are you listening to what your fascia is telling you? Take the time to reflect on your own body mechanics, respect the amazing complexity of your tissues, and always make informed, empowered healthcare choices. Thank you so much for joining me for this explainer, and keep learning.